You're watching CommonWell TV. We're in Orlando, Florida for HIMSS 2017. Scott Adams here with you, being joined by Jittin Asnaani, who is our Executive Director of the CommonWell Alliance. And Jittin, let's talk a little bit about maybe how passionate you are about breaking down some barriers of healthcare exchange.
Absolutely. When I got into health IT, I was just really interested in the fact that there were just some really intriguing, difficult to solve problems. And it was just a space that was ripe for innovation and for people to dig in and get and learn and participate and contribute in a meaningful way. And I barely gotten in when I started learning about so many people, people who I knew closely, people who I just met, who were experiencing health IT in a way that really it just shouldn't be. People, the CEO of the first health IT startup I worked with, she had just been through 2 years of managing a pretty severe disease to the healthcare continuum. And her stories about how just difficult it was for her to get her information, for her to be able to just really manage her doctors in order to get the right care, was just a story that really got me thinking, well, there's this aspect of healthcare IT and interoperability that maybe is being underserved. And then I've just seen more story, if you listen to the story about, the CEO of Cerner, Neil Patterson, and his wife, and what she had to go through to, again, person who is in a position to really be able to, you think they'd be in a great position to be able to get the data, and it's so difficult for them to get data from all these other systems. And then most recently, when I had an opportunity to sit down with Vice President Joe Biden, and he talked about his son's experience and how difficult it was for him, a person clearly in a sort of a position of authority, to get the data on his son. It was just like such an indication to me that it's so broken. There are these beautiful personal stories. There's lots of big numbers too, right? It's big for healthcare, it's big for a GDP and all of that, which is all very true. But it's all these personal stories, and there's no lack of them, of people just not being able to engage as patients with their caregivers, giving their caregivers a sort of empowerment. That's what really gets me kind of up in the morning saying we need to fix this, and that's what CommonWell's trying to do.
I was going to say, with that, then, what are some of those unique characteristics that make interoperability within the CommonWell Alliance so unique?
Absolutely. The thing about CommonWell is I always think about it, if you had to distill it to one word, it's about empowerment. It's not about let's make that connection or let's make lots of connections efficiently. That's not what it's about. That is what happens, but that's not what it's about. It's about an individual and their caregivers having the ability to be able to know that, yeah, I have a whole story, I have a whole picture on this individual, I know where they've been. Me as an individualist know that, yeah, my provider has got this. He knows what he's doing because I've helped him to know what he's doing. Or, you know what, I really want to have a piece of this too because this is my healthcare. To actually be able to make that decision and not just be a victim or just a sort of a cog in the healthcare machinery that tends to drive you in a direction that it wants to, but that you actually have a role in it. That's what CommonWell is really fundamentally about. And we built the unique pieces in our architecture and so on that enable that. But those are all, at the end of the day, that sort of person-centric architecture, which we're very proud about, is really just an enabler of this vision, which is really what drives us every morning.
We'll look to the future here in just a second, 2017, but maybe some milestones for the CommonWell Alliance there in 2016.
In 2016, I think the big thing which we really did was, we've been on this path of expanding our network of EHRs. What that really means is hospitals, ambulatory facilities, critical access hospitals, expanding those and expanding that breadth of the network so that we can really follow patients in all these locations. In 2016, I think the big ceiling that we just completely broke through is that we started going live in other types of locations. Guess what? Patients get a lot of care at their pharmacist. They get a lot of care at their in a home health setting. They get a lot of care in a skilled nursing facility. They want to get engaged in their care through their own patient portals. There are all these places that patients go for care today. And now we've started enabling them to go live on the CommonWell network. We're live with home health, we're live with patient portals, we're live with these places that really allow us to ensure that the patient's whole story can be captured and that the patient has an opportunity to share that with his provider as well as be able to look at it himself or herself.
So the horizon for 2017, what are some of the possibilities that are out there for this year?
Well, I think two big things are going to happen this year. First of all, as a network, we've always we've always looked at, the place we started was, if I'm a patient, or if I'm a provider, if I'm some other sort of caregiver, a parent, a teacher, whoever that, right, a social worker, whoever that caregiver is, I want to be able to ask for the data for that patient and receive it and know that I got the data from wherever that patient has been. But there are other things I'd want to be able to do too. I'd like to be notified when a patient has been somewhere. I'd like to be able to share that information for other purposes that I have the right to, and right now I have to go through a very manual process to get. Like if I want to share it so I can get disability insurance coverage. For the average person trying to get disability insurance coverage from, let's say, the Social Security Administration, it's a do I buy food or do I buy medications decision until they get that coverage, and it takes them a long time to get that coverage. To the extent that we're enabling health beyond just specifically health care. The second thing that I'm really looking forward to of the coming year is as we kind of expand beyond where CommonWell is right now. We're creating a larger and larger network, 5,000 sites already live, another 5,000 coming live. Tens of thousands on the horizon over the next few years. But there's always going to be something beyond CommonWell as well, and we're cognizant of that. And we're starting to form those partnerships with other organizations. Last year we announced a partnership with Care Equality, for instance. We've been working with the Argonaut Project and the work that they're doing. We're working with others to ensure that wherever the patient goes, inside and outside of CommonWell, we have an opportunity for our members and their customers, the providers, the patients, the social workers, to be able to get that data on them.
CommonWell recently introducing the building of the API to complement some of its core existing services. So can you share an example of how this new API can really benefit the healthcare industry?
Yeah, absolutely. So one of the APIs that we're building we're aiming to build this year that our members are very excited about is what I call a proactive notification API. And it really allows an organization or a provider organization to be able to subscribe to patients to know that when a patient checks in at a particular other facility, that they're checked in there. This is immensely important in healthcare because, as you know, if I'm a provider, particularly let's use an example. I'm a PCP, I'm taking care of my patient. Patient checks in at an emergency department. There is valuable information I have that can affect that patient's care, that can actually make a difference, even though they're not here in my four walls of my clinic. If I'm notified of that, I have an opportunity to provide that intervention, to provide that information that can make a big difference in that location. And I'm happy to do so because I'm trying to be the best doctor for that patient and try to get that patient's care and his care up and his costs down. So that's one of the APIs that we've been talking about and that our members are very excited across the board about enabling.
Exciting news on the horizon for interoperability. As the Executive Director of CommonWell, Jittin Asnaani, we appreciate the time and the info. And for more on CommonWell, make sure that you jump onto our website, CommonWellAlliance.org.